Welcome, everyone, to today's virtual Move the Needle, the Failures and Future of the U.S. Foster Care System. My name is Savannah Lane. I am the Director of Education and Experiences here at the Policy Circle, and I already see some great comments in the chat. We've got people tuning in from Tampa, Denver, Indiana, so we're really excited to welcome you all today to this interactive conversation. So keep the comments coming. The Policy Circle's mission is to inform, equip, and connect women to be more impactful citizens. And we do this in a number of ways with interactive programming like today, policy briefs, and so much more. And today we are tackling a really important topic, and the topic of the Policy Circle's latest brief, foster care and child welfare in the United States. And our goal today is to really bring some clarity to this complex issue, unpack more of the challenges, have some interaction with our interactive Q&A, and really drive understanding of what we can accomplish at the local level after this conversation today. And in researching this brief, our team really uncovered some staggering statistics that we want to really dive into. In the United States, more than 400,000 children are in foster care on any given day. And this obviously has ripple effects in so many ways. One study showed that, for example, almost 30% of former foster care youth experience homelessness by age 21. So you can see there are a lot of layers to this that we need to dive into. As I mentioned, the Policy Circle recently published the brief, so I encourage you to visit our website, which we'll share the link to soon, and check out this brief. Read it, discuss it with your network, and share it with others to dive deeper into this conversation. Today, I am joined by two incredible panelists that we are going to hear from. We're very lucky to hear from them today, Naomi Schaefer Riley and Megan Rose. And first, I'd like to welcome and introduce Naomi Schaefer Riley. Naomi Riley is a resident fellow at the American Enterprise Institute, focusing on issues regarding child welfare, as well as a senior fellow at the Independent Women's Forum. She also writes about parenting, higher education, religion, philanthropy, and culture. She's a former columnist for the New York Post and a former Wall Street Journal editor and writer, as well as the author of 7 books, including most recently, No Way to Treat a Child, How the Foster Care System, Family Courts, and Racial Activists Are Wrecking Young Lives. Naomi graduated magna cum laude from Harvard University in English and Government, and she lives in the suburbs of New York with her husband, Jason, and their 3 children. And our second panelist that I'd like to welcome and introduce today is Megan Rose. Megan Rose is the CEO of Better Together, an organization that strengthens families and communities by promoting work, protecting children, and supporting families in crisis. Founded in 2015, Better Together provides a voluntary path to prevent the need for foster care through its Better Families program, which has served more than 5,000 children and kept 98% of them out of the system. Megan Rose has dedicated her life and career to strengthening families and reminding people of their dignity, worth, and value. So let's go ahead and make the most of our time here today and bring Naomi to the screen. Naomi, I want to start with you. So first, welcome and thank you for joining the Policy Circle's Move the Needle conversation today.
Thank you so much for having me.
It's great to have you here today. And there are so many angles we can take this in, but I think it would be great to kind of hone in on just an overall, broad brushstrokes of some of the major challenges. As we mentioned in the beginning, currently in the United States, more than 400,000 children are in foster care on a given day. And in your recent book, No Way to Treat a Child, you dig deeper into the policies that you describe sometimes as not only ineffective, but at times also inconsistent. So can you give us an overview of these major challenges we're seeing today in the child welfare system?
Sure. Well, there are about, just to kind of start at the beginning, there are about 3 million calls that come into child abuse hotlines and different authorities every year reporting different kinds of neglect and abuse of children. About 600,000 of those end up being substantiated in some way or another, which means that we have some evidence that something did in fact go wrong in that family. It doesn't mean that the remaining calls didn't happen or that they were frivolous in some ways. It just means we just don't have enough evidence one way or the other. And then what happens is in the most serious cases where we have sense that this child is at imminent risk of harm, the state can move to remove a child from that family. There are different placements for a child who has been removed from their biological home. They could go into a foster home. In rare cases, they might be put into a group setting if there are severe mental or behavioral health problems. But for the most part, they would go into either a relative or a non-relative foster home to care for them temporarily. And obviously, the first mission of the child welfare system is to figure out how to help the parents rehabilitate so that family can be reunified. And that is really the kind of driving force of a lot of child welfare agency policies. We provide families with a lot of different kinds of services. If they have material needs, we try to help them meet those. If the parents have substance abuse or mental health issues, we try to provide them with services. We provide parenting classes, anger management classes. The system is really doing, I think, whatever it can in order to try to reunify those families. Unfortunately, there are a lot of cases where that's not possible. It's not a lot in kind of the grand scheme of things, but it's a lot in the system. And what we're seeing is that there is an increasing amount of pressure to keep so many kids out of the foster care system and to keep families together at all costs. And I think that, as conservatives, it is really important for us to value the importance of keeping a family together, and all things being equal, obviously the parents are the best people to raise this child. But if there is a serious history of abuse or chronic neglect, it's something that we have to be careful of and be aware of when we're trying to protect children. And so I do compare it to, domestic violence in some cases, just to give people a sense of what is the kind of driving force here. If police were called to a domestic violence incident, and the first question they asked was, oh, we see your husband or boyfriend has been beating you. How can we get you guys back together? That's kind of the first question, and often the question that is asked over and over again over the course of years for children. We do try to set limits on how long kids can be in foster care. Child welfare systems are run by states and counties, but about half of the money for them comes from the federal government. And so there are some federal guidelines and laws for what states need to do. One of those is the Adoption Safe Families Act. It was passed with a bipartisan support in the 1990s with the goal of ensuring that kids do not languish in foster care indefinitely. So if a child has been in care for, say, 15 of the last 22 months, the state is supposed to move to terminate parental rights. That can sound like a very harsh thing. In recent media reports, it's been compared to sort of the parental equivalent of the death penalty. But I think we are really failing to keep in mind the damage that is being done to kids who are being left in care much longer than that, 3, 4, 5 years at a time, in these very temporary settings. Sometimes they are with the same foster family. Sometimes they're experiencing multiple placements. Sometimes they're with the same foster family, say from birth to 3, and then all of a sudden we decide it's time to reunify them, and we remove them from the only parents essentially they've ever known. And so, those are kind of, I think, some of the biggest challenges of the foster care system. I think the hardest question the foster care system has to answer is, how long should a child wait? It's a really important question to ask, because I think we are often weighing the interests and the desires of parents. Adults are very good in some sense at expressing their needs, but it's very hard for courts and agencies to really understand what is in the best interest of the child, because a 2-year-old and 3-year-old has a lot of difficulty saying that. And so just having a much better understanding of what is in the best interest of the child, I think, should be the focus of our child welfare policy right now.
Thank you, Naomi. That's really helpful. And we're going to dig more into, what we can do, local solutions, and even a little bit more into this push for family and parental reunification in a moment. But I want to kind of paint a picture of the statistics, because there are often inconsistent measures, right? And you talk about this in your book and research. And so I would love to hear from you, a little bit more. In your book, you mentioned this of, this reported number of decreasing foster care numbers. We're seeing a decrease, but this may not paint the reality. So talk to us about why this is and why this could be such a concern.
Sure. I mean, I think what people need to understand when they read a headline about the number of children in their state or their county who are in foster care is that that's an artificial number. I mean, we can choose, like in the same way we could choose to decide, how many people to prosecute for a crime, or we could choose, how many people we want to go after for a particular law. These are policy decisions. And so it's not necessarily a sign or even a signal of how many children are being abused or neglected. What it's a sign of is the capacity that we have created in the system. And so if you sort of say, well, we want to put less money into foster care, or we think it's much more important for kids to stay with their biological families or with a relative, then what will happen is those numbers will go down. But some viewers may have recently read stories about hidden foster care. And what that is actually when a state comes in, recognizes that abuse or neglect has happened, and then sort of starts kind of behind the scenes calling relatives and saying, hey, would you mind just taking this kid? We're not going to pay you. We're not going to train you. And by the way, we're not going to keep track of what happens to that kid after we place that child with you. So it's a way of kind of the state getting out of its responsibilities in a lot of ways. But what the state agencies are experiencing is a lot of pressure to keep those foster care numbers down. But doing so is not necessarily in the best interest of that child.
That's really helpful in understanding this kinship care and then how it translates to either the lack of follow through and check-ins, as you mentioned, and then how it translates to our numbers, and so seeing those measurements and how they may not paint that picture, I think is really important to put into context this issue. I have one more question for you before I want to bring Megan onto the screen, but you share, and you hinted at this in the beginning, but this push for, in the foster care system, parental reunification, and also the question of how long should a child wait? So as they're waiting for this parental unification, talk to us about why this is problematic as a kind of a default policy, and what you would prefer to see.
Sure. I mean, I think developmentally, we know so much more now about, especially young children between the ages of 0 and 3, the kind of attachment that they need in order to experience proper social, emotional, intellectual development. They need to be able to attach to really at least one person securely for the course of those years in order to understand that their needs will be met. And when their needs are not regularly met, what you find is that you get in the most extreme circumstances, things like reactive attachment disorder, but you also get, children who are, always looking for immediate gratification, or, because they don't trust the adults around them. And that can have a really important and detrimental impact on their later development. So, my feeling is that, we should do whatever we can up front to try to get children who have been abused and neglected back into rehabilitated families. We should provide them with as many services as possible. We should be doing more to ensure that those services are provided in a timely way. But we should also think about those timelines and say, no, actually, we're not going to leave kids in care indefinitely, because it is important that, and by the way, that might mean we think we need to permanently place that child with a relative, or we need to permanently place that child in an adoptive home. It's not necessarily a prescription for where that child needs to go, but it is sort of saying we can't go back and forth taking this child in and out. And I think, viewers probably will understand this if they understand that as many as 80% of the cases that are coming to the child welfare system involve substance abuse and or mental illness. And when you understand, when you've seen someone go through addiction and you've seen how many relapses are occurring, like obviously we want to continue to help those people in as many ways as possible to fight their addiction. But there is a child sitting there whose clock is ticking. They are waiting for a responsible, caring, loving an adult who can be in their lives. And if that mother is just in and out of rehab, or in many cases, not even taking that step because they're not ready for one reason or another, that child's development is being severely impacted. And we need to understand that and do something in a timely manner.
Certainly. And I think that's a great point, is that we can't just think about the policies. We have to think about the timing and the impact on children. And that's really what's at stake. So Naomi, don't go far here. We're going to bring you back on screen, but I want to switch gears a little bit and bring Megan Rose back to the screen. So Megan, thank you for joining us and having this conversation with us today.
Thank you so much for having me.
Sure. So we just heard from Naomi, Megan, about this concern at times for this push for family reunification and what that time and waiting period can look like and the impact on children. But this is, switching gears here a bit, because Better Together's efforts are directly supporting that family reunification and the push to continuing to support families. So talk to us about what Better Together is doing. What's your model? And tell us a little bit more about your programming there.
Yeah, so Better Together provides a dignified way to prevent child abuse and neglect by strengthening families using what we believe the most powerful yet least leveraged forces in America: compassion, volunteerism, and the local church. Children we serve are on the front doorsteps of foster care, but our program catches families before they fall. It's very preventative, very upstream. Our innovative Better Families program has helped more than 5,000 Florida children with a 98% success rate, which means the families that we're working with are not having further intervention or interaction with the Department of Children and Families up to 24 months after we work with the families. We don't do it alone. We've built this highly dedicated network of hundreds of volunteers across the state of Florida who care for children short-term. They mentor parents towards stability, and they really create that village. You hear the saying, it takes a village. And that's what we're trying to do, is just connect families in our community who are isolated and they don't have that healthy support system in that village. So these parents might be struggling with homelessness, drug treatment. They might have a hospitalization. It's a single mom. They need to seek treatment for something, but they have nobody to care for their children. It might be a jail sentence, but our parents are really brave. It's voluntary. Nobody is forcing them to better themselves and better their situation. These are situations where abuse has not occurred yet, and there's no legal means to be able to place a child into foster care. So what we do is we focus on empowering the parent. We focus on coaching, tough love, and really hard work. We know that children benefit from parents who are healthy and working. And our programs help keep children safe by helping parents achieve their goals and giving them the support and resources to be successful. After finding out that 80% of the parents we served had spiraled into crisis as a direct result of job loss, we created a jobs program to equip and train churches to host job fairs and a job ministry and a unique atmosphere of just celebration and hope. These are not your typical job fairs. At each event, 1 out of 4 people get hired on the spot. You see moms walking around with their strollers, with their kids, because if you don't have childcare, it can be really difficult to get a job. So we create an atmosphere that really focuses on people's future instead of their path and just removes barriers to employment, but also connects people to relationships. And 2 out of 3 attendees get hired on the spot, and 60% find work within 6 weeks. So together with more than 150 church partners, we've been able to connect over 34,000 people to job openings across 22 states.
That's fantastic. And I love that you're bringing in this impact of opportunity and really serving in that preventative measure, which I think is an important note of your model and your program. So aside from the better jobs and providing these opportunities, what are some of the other success points that you have seen with Better Jobs and Better Together?
So we've built this incredible private-public partnership with the Department of Children and Families by becoming a really valuable tool in their toolkit. Like Naomi said, they get thousands, millions of abuse hotline calls every single year. And they go out and they do their investigation. And unless a child has been physically abused or neglected, most of the time they can't intervene. So when they come across families that are isolated and they're in crisis, they're able to connect those families to Better Together in our network of trained, embedded volunteers. Better Together is all about having private funders build a volunteer support system for at-risk families to help families willing to help themselves overcome that crisis by helping parents rebuild their self-respect through employment and support. We believe the state should step in when children and families' needs exceed the capacities and resources of the community. If Better Together can help families help themselves so they never get involved with government at all, everybody wins. So once they're in government system, though, these kids and their families need all the support they can get. We need to help kids survive the foster care system by giving them constant and continuous support, not only for children, but also the caregivers, whether the caregiver is a foster family, a relative, the biological parent, or the non-relative. I believe that everybody can do something to prevent child abuse and support vulnerable families. I believe the community can step in and play a significant part in preventing the breakdown of families and keeping children safe. And we see that every day through the work of Better Together. And I would say Florida, I think, has got it right. Governor DeSantis and First Lady DeSantis and the DCF Secretary Siobhan Harris really set a great example for other states and localities. They've created networks such as Hope Florida, where they can connect the needy with existing private nonprofit services like Better Together. They've learned how to maximize community collaboration outside of government. They recognize the passion of Floridians spending their time and treasure helping others. But unfortunately, many are working in silos. So they have really focused on eliminating silos. And that's when they started Hope Florida, which seeks to really maximize collaboration among the public and the private sector to help families. And I think this is an example that other states and localities should recognize. And also just the power of the faith community. The faith community has been an ever-growing leader in promoting families, helping families stay together. And a growing number of churches are creating ministries to promote volunteering with Better Together, becoming foster parents, volunteering as guardian litems, and assisting those who are caring for children by providing meals, diapers, and other supports. And I think that's really critical and something that we need to see just grow and expand into other states.
Thank you, Megan. It's really great to hear the robust programming that you're focused in. And I want to bring Naomi back on the screen here. We're going to do a little bit of a rapid fire, and then we're going to move into audience questions. So I see some questions already in the queue. If you are watching and tuning in our live stream, feel free to comment, and we will hopefully have time to answer as many questions as we can here. So Naomi, we just heard from Megan a little bit more about the successes. So I want to turn to you. I want to be an optimist here. And I want to ask you, what in your research have you seen in either policy solutions or practices that locales are adopting that have been successful in mitigating some of the concerns that you highlighted earlier in the conversation?
Sure. Well, I think, there are different ways to think about, prevention. I think, what Megan is talking about, and she does, Better Together just does such amazing work, but it's really important to think about that as upstream work. Like, as she said, these are kids who have not already been abused. In some cases, they've experienced some kind of neglect, although it's rarely kind of the serious and chronic neglect that will lead them necessarily into the foster care system. But I think it's important to get those families very early on in the process. And, what Better Together is dealing with, and I think what we need to encourage more of is, parents who recognize that they're in crisis. You have to have a certain amount of sense that you need the help. And, yes, maybe you had a visit from child welfare and maybe that was the wake up call for you. But even families that don't necessarily have that, like, you recognize, oh my gosh, I have no place to leave my child, while I go into rehab. Like, you want to be able to turn to someone, and you don't necessarily want to be able to turn to the government, which I think makes total sense. So how can we sort of do that upstream? I think the bigger question, I think really the bulk of the kids in the foster care system. And, so we're talking about two things here, the foster care system and the child welfare system as a whole. And the child welfare kind of universe is much bigger than just foster care. Like there are a lot of families that are involved with child welfare whose kids have not been removed from their homes. So the question, I think, then becomes for the parents who are in foster care, whose kids are in foster care, what can we do there? So like I said, I think we should be providing them with a lot of services up front, and we should be doing it in a very timely manner. So some viewers may be familiar, for instance, with, what are called drug courts. So that exists like in the criminal kind of area where, a person who has committed a drug offense then goes through kind of is diverted into a different sort of program that may not be, prison or criminal sentencing, but we're trying to help rehabilitate them. So there are also family drug courts where a family whose child has been removed kind of gets to, it's almost a fast track in some ways to be able to get that child back. But what's required of that parent, and again, they go through this voluntarily, is weekly check-ins with a judge. And the people who are assembled for those hearings, it's quite incredible. They bring in all sorts of different, people from both the public and private sector. If that parent is in need of drug rehab or transitional housing or has material needs, all of the people are there on the spot, and that person also has to take a drug test every time they come. And so what it does is, I think it provides a level of accountability, but it also keeps cases on track. And family courts are notoriously slow and inefficient, and they're not making, even when it is possible for a child to go back to that home, their family courts are not making that decision fast enough. They're just dragging their heels in many cases. In many cases, they have too many cases. So that's one of the things, like, any way we can sort of make this system kind of work better for these families and ensure that they are, getting everything they need as quickly as possible, to either reunify or to determine that, they're not interested in doing what they need to in order to reunify.
It's really helpful. And clearly, I think the theme of, the timing and how we improve that is really important, both in policy and community levels. Now, I want to ask you both the same question. We are a community of action-oriented women here at the Policy Circle. And so I want to be able to give this call to action for those tuning in today. And Megan, I'll start with you. What action can our viewers today take back to their communities and really work to support or improve either the foster care system or the child welfare system in their local communities? So Megan, I'll start with you.
So I believe everybody can take action. We need more action. We need more people to get involved in their communities, whether it's on prevention and supporting vulnerable families, whether it's becoming a foster family, a guardian ad litem. Sometimes guardian ad litems are the most consistent voice that a child has. Sometimes it's called CASA in other states. Maybe it's donating diapers, formula, supporting. I've been a foster mother. I've taken children to our home. You're dealing with a lot of trauma, a lot of behavior. So anything that can alleviate that stress on that family and help that transition be a little bit easier makes a big difference. And being able to provide respite support, but also just advocating with your legislators. I think we should move heaven and earth and help these kids survive once they're in the system and make sure they have all the resources and supports that they need. And being able to advocate for those supports, those services, the funding needed to help these families, and then hold them accountable. There needs to be accountability and there needs to be transparency. And that's really important on a local level, but also on a state level. And we all should do our part to be invested in how many kids are in that child welfare space? What are the issues in our community? And then finding out a way that you can get involved and support some of the really great solutions, either in the prevention space or in the space that when children are already there and they do need that support.
Thank you. And Naomi, I want to hear from you as well. What are some of these action items that our community members and viewers can take back home?
Yeah, I would say absolutely. Obviously, volunteering to become a foster family or, support foster families in your community. And I would echo what Megan said about guardians ad litem, but also, some places, you could be a CASA. I think the benefit of that is not only, frankly, that you're helping children, but also I think that more of us need to have eyes and ears on the system. And we're very disconnected from the kids and the families in the system. And to get to see what's going on in family court, I mean, I have been numerous times, and every time I leave more outraged than the time before. And I think that spurs people to action. But frankly, I think it also makes people in the system sort of recognize that we can't just operate, without transparency, and we can't just operate pretending that there aren't, regular citizens out there who are seeing what's going on. So I would definitely add to that. I mean, one of the things, we talk about strengthening families, and I see this in the comments, one of the questions about the underlying causes of child abuse. I mean, there is no question, substance abuse is one of the driving factors, but family structure is highly correlated with child abuse. A child who is growing up with a non-relative male in the house is about 10 times as likely to experience abuse as a child growing up with two married biological parents. Now, I am not trying to throw step parents under a bus here. There are plenty of wonderful families that involve the non-biological relative, but I am saying that I think when we're thinking about how to provide the most safe, secure environment for children to grow up free of abuse and neglect. One of them is definitely strengthening the family.
Megan, we kind of, thank you, Naomi. We kind of jumped into some of the audience questions, which is great. So thanks for bringing us there, Naomi. And one of them I want to continue with you, Megan, is, what are you seeing as some of the factors? We've heard a few from Naomi, but are you seeing any additional, especially in your community, that are contributing to these increased numbers?
So I'm a mom with 4 young children, and parenting is really hard. And I'm very fortunate that I have an education, I have a spouse, I have a support system. I have a job that is stable. And you think about a lot of what these parents are facing. We went through a national pandemic. We've had a lot of challenges with inflation. It's very transient. So families aren't living next to their families. And you see a lot of generational cycles of abuse and neglect. Families are, mimicking what they learned from their parents, which isn't necessarily healthy, but they don't know, they haven't been exposed to a healthy mom and dad, a healthy environment. So they're really repeating what they're learning at a young age, which isn't necessarily healthy or productive. So I think there's a lot of just pressures on families, and parenting is really hard. And you need a village, you need support, you need people. So I think it's really important. I think COVID isolated a lot of families. And you still see a lot of isolation with social media. But families need people. They need people in their lives that are healthy, that are going to pull them up when they fall, that are going to encourage them, give them support. And I think that's so critical that we build community on a community level. And I think the mentorship is really important to be able to expose families. We've had families that we have worked with. We had a mom, and she came over for dinner, and she was really quiet. And after dinner, she went up to me and she was like, "Is your husband always this nice to you?" And I was like, "Yes." She's like, "You guys don't yell at each other?" I was like, "No." She's like, "What if you fight?" I was like, "We have disagreements." But she had never seen that in her life. She saw a mom who struggled with domestic violence, and then she started, to go into unhealthy relationships. And years later, she came back to us and said she found a really great man who didn't yell at her and was like my husband sees Mason, was like my husband Mason. And but she needed to see that. She needed to see it up close in person. And also, a lot of families are used to living in chaos. So when you invite a family and they see a calm, they start to see that it doesn't have to be all chaos and crisis constantly. And so I think just the village community, I think jobs are important as far as stability. Research shows that if you are working, you are less likely to abuse a child. And that does alleviate a lot of the financial stress on a family. And I think there's just a lot of different things that are contributing and compressing that issue and making it harder to keep families together and keep them strong. And it all impacts those kids. I mean, those kids are watching their parents, from a work ethic to, the parenting styles, to the screaming, and, the cycle repeats. So I think it's really important, early intervention and helping families upstream as quickly as possible.
It's great. And we have a lot of questions coming in here. So for our audience, keep them coming. We may combine them and try to get through as many as we can during the time we have left. But 2 people asked a similar question. So I want to focus on this one. And this is something we haven't touched on too much, but we focused on, of course, the children. But let's say that they are now placed in a foster care, foster home. What are the barriers to foster parents? How can we better support foster parents and foster families? And where is any of the tension or friction in supporting these people that are stepping up and wanting to help? And Naomi, I'll start with you.
So, there's enormous, it is enormously difficult to be a foster parent. And you see that the statistics suggest about half of foster parents quit within the first year. So you can imagine we invest all of this time and resources into trying to train these folks. And then, they throw up their hands after a year. And so, what are the reasons for that? Obviously, foster parenting can be very hard on a marriage. It can be hard on other children in a home. Sometimes people do go into it with a certain amount of naivete. They assume that because, they have raised their own children fairly successfully, that they can do this. As Megan said, these kids have often experienced just really levels of trauma that most typical parents just would never understand. And so we need to do a much better job of training them on the front end in order to support them. Community members need to come around and also understand what it is that their friends and neighbors have gotten themselves into, and understand what it means to have a foster child, what it means when that child, throws a fit during church or someplace else, that it's not a sign that this foster parent is failing or has done something wrong. But I also think, the system treats foster parents terribly. You don't get a lot of respect. Sometimes, the caseworkers are just overwhelmed, but sometimes the foster parents are really, like, in the system, they're just treated as glorified babysitters. And you see this just even in the way courts treat them. I mean, the number of foster parents I've talked to who've cared for a child for 2 or 3 years, and when they go to hearings, the judge doesn't even ask them what they think about anything. I mean, to have this person caring for a child day in and day out, and have our system not even be interested in what this person's perspective is, I mean, even if it doesn't have legal standing, I think is just outrageous. So a lot of these parents really do quit because they feel like the system is treating them terribly. The children are sometimes removed from their homes without any notice. They can't say goodbye properly. They're not given any sense of who the child is who's coming into their house. Some of these things are related to privacy, but, you have to tell a foster parent, if this child coming into your home has a history of sexual abuse, you're putting that child into your home with other children. So how can we do a better job of respecting foster parents and treating them like, the amazing volunteers that they usually are, rather than, like I said, just, glorified teenage babysitters?
Sure. And Naomi, this is something you actually touch on in your book too, especially sensitive to that when it comes to children who are medically fragile or have a lot of medical complications, which can be challenging. And I want to ask one more follow-up question to you, Naomi, and then we'll turn to you, Megan. And that, this, our Stacey Blakely commenting here, she mentions in the follow-up to this is that you think paying foster families attract people for the wrong reasons.
So in some cases it does. I mean, but you have this sort of vicious cycle that happens where we don't pay foster parents very much. And so the people who are attracted to doing it are the people who think, that amount of money seems like a lot and seems like it's worth it. And so I think, but then you sort of say, well, should we pay them a lot more? And maybe that will even exacerbate the problem. So what I think is that we need to do a lot more on sort of the treatment end, because for middle class families, and I'm not saying that poor families can never be good foster parents, but I will say that for a child who's experienced significant trauma, to go into a family that is experiencing financial stress, I think adds a burden that is just, it's not necessary to put that child through. And so I want to see more, just solidly middle class families think about foster care. And I think that those families, could be, reimbursed for the expenses that they have for the child. More often than not, frankly, a lot of middle class families are putting money out of their own pockets to do things like pay for, therapy for these kids because they can't get the system to do it in a way that's timely or helpful. So I think that the payment system is a difficult one. I think that it really has to be the question more on recruitment. How can we get people who are not in it for the money doing it?
Certainly. And we see our commenters here, mentioning this exact thing, talking about paying out of pocket, getting children into therapy, and it adds up, and it's a huge challenge. So that's a tricky issue. And so, Megan, I want to allow you to touch on that as well, with your thoughts on the burdens for or challenges for foster parents.
Yeah. So I think the process needs to be much quicker. It shouldn't take a foster family 6 months to be approved. There needs to be efficiency. They still need to do their due diligence and vet out families and give them tools. But they really do need to streamline that process and make it easier for families who want to raise their hands and open up their homes to be able to do that. Because of the red tape and all the paperwork and everything, and just the way it's organized can be overwhelming. So you see a lot of families get frustrated and walk away in the process. I would say another thing is I think the best way to recruit foster families is retention. Really taking care of the families that are, gold, the ones that are doing it for the right reasons, that giving them great customer service, being responsive, getting them the tools that they need for these children. Because that is a huge frustration. If you see a child that you are with 24/7, that you are growing an attachment with, you care for, and you see that they're not getting the support they need, whether it's counseling or additional services, that is incredibly frustrating, because then those behaviors are impacting your own children, your marriage, and then ultimately it's a child. They deserve that. They need to work through that trauma because it's impacting their education and their development in those really critical years. So child welfare should be responsive. They should have enough providers. They should be able to meet the needs of these children quickly and provide a 5-star customer service experience. They need to work on turnover with case managers. When you have constant and consistent turnover with case managers, that can be really difficult on a case moving forward. And then also difficult for a foster family not having a professional point of contact to be able to reach out to and talk to on issues. And I agree, there needs to be transparency of the children that are coming into your home, but also, tools and ongoing resources. And this is where I think the faith community has really stood in the gap. They're supporting these families and wrapping around them when they're welcoming these children into their homes and listening to them. And the government needs to see that as a great resource and tool, but they need to be doing everything in their power to make sure that these foster families, I believe it's quality versus quantity. But when you do find those quality families, giving them everything that they need to be successful and letting them have a voice. And I agree with Naomi 100%. They should have a voice at the table because they're the ones caring for these children day in and day out. And they know these children incredibly well. And a lot of foster families are also getting to know the biological parent and building a relationship with them as well. And so there just needs to be more communication, more transparency, and more respect.
I see a comment in the chat about termination of parental rights. And I wanted to just bring up here, because one thing that happens with foster parents, I mean, many foster parents, will foster, 20 kids, and some of them will stay for 3 weeks and some of them will stay for a couple of months, and they sign up understanding the temporary nature of it. But there are a lot of foster parents in this country who, not necessarily wanting to get into it for the purpose of adoption, end up fostering a child for years at a time. And then they find that the system has decided, like I said before, all of a sudden now we're going to reunify, or now we're going to stick this child with a relative who we never knew existed before. And that family that foster family not only experiences the just complete devastation of basically someone who's been a member of their family for 3 or 4 years, suddenly, having no contact with that child, but also the sense that they have not then served that child well, that they have almost been part of a broken system that has led a child to be ripped away from the only family they've ever known. So I think a lot of, foster parents start to feel like, am I part of the problem? Like, even if I am doing everything I can, if I can't protect this child from the kind of trauma that the system is kind of raining down on them, I'm not sure that I can continue doing this. And I think we need to understand what that happens and how that affects retention of foster families, because someone who's experiencing that is never going to sign up for foster care again. It's impossible. The child's, the siblings in the home, to experiencing that kind of loss and then just say, okay, I'm going right back to this. It's really just too much to ask of people, I think.
Certainly, and it compounds the trauma that you had just mentioned. So I appreciate that you picked up on that comment from our audience. I want to go back a little bit in the comment scroll, if you will, because something we haven't really talked about is, the challenge of after foster care, when our children are turning 18 and they are the young adults that are suddenly maybe not within a network of resources that they need. So what are the services that are out there? Is there a gap that needs to be filled in communities for children who are no longer technically labeled children, but still very much need the support and the resources to continue into young adulthood? And Megan, I'll start with you.
Yeah, so I have a huge heart for foster youth. And we were a permanent. We were a non-relative caregiver for a 17-year-old just a few months ago who was about to age out of the system. And we just heard through the grapevine that this girl was just going from, home to home. And she had a history. She went Bonnie and Clyde with a boyfriend when she was 12. And on paper, she looked terrible. But this was a young girl who had experienced a lot of trauma, who didn't get the support she needed when she needed it. And, there's a lot of fear of welcoming a teen in your home, especially when you do see the background and the history. But we had it, there's tools and resources to be able to create a healthy and safe home. And our children loved her, and we love her. She's a part of our family, but, we help her. We help her with guidance. How do we're trying to help her find a job, help her find an apartment. A lot of these little things that we take for granted that we learned from our parents, these families and these kids, they just don't have. And we see this a lot with Better Together, is we get a lot of young parents who have aged out of the foster care system. And they aged out without a support system. They aged out without the tools and resources that they need. And now they are having a baby. And a lot of them don't want to be their parents. They don't want to end up losing their children. And so we're able to come alongside and support them and give them community, help them with resources, help them with employment. And that's really important, because you think about it, if it's incredibly heartbreaking that these kids are literally aging out, and it's like the strike of midnight, Cinderella, everything goes away, all their supports from their caseworker, their guardian ad litem, to the judge. The judge can be a huge consistency and support to a lot of these youth, and they build relationships with them. Everything is gone. And they do have, some resources as far as funding. There are some independent living and different tools, but they need hands-on people in their lives to support them and guide them. And you'll get a lot of youth that don't want to be adopted because they don't have a lot of trust. And there's attachment issues, but they still need family. They need people who are going to support them, walk alongside them, and just be truthful and transparent. Our young lady, we talked through with her and reminded her that she isn't a statistic. She wasn't pregnant. She was still in high school. She was doing really good things, and we focused on those things. But we also were transparent that this is the sequence and the things she needs to continue to focus on if she wants to break this generational cycle in her life and be successful. And so no one had ever told her that. And she had been in the system all her life, and nobody had that conversation with her and was brutally honest, and also focused on her strengths instead of her negatives. So I think it's really important to lean into these kids and be real and honest and transparent, but make sure they have hands-on tools and supports and systems and people that they can lean on to, because they deserve it.
Thank you, Megan. It's really great to hear of your work. And so I just want to wrap up with a few more questions, if we can squeeze them in before we close today. One question asked about FFPSA, the Family First Prevention Services Act. What did they get right? What did it get wrong? Where are the gaps that are still existing? So Naomi, do you want to touch quickly on anything with that federal legislation?
Sure. I think that the idea that we should be putting more resources into prevention obviously made a lot of sense to folks on both sides of the aisle. I think what unfortunately, the way the narrative sort of worked on this legislation was, if we put more resources onto the front end, then we won't need as many resources on the back end. And specifically where Family First kind of took away resources in a variety of ways was in the area of congregate care. And this really relates to the question that you just asked, Megan, which was, what about these older youth? Particularly, you see older youth with behavioral mental health problems. I mean, we can talk a good game about how it's important to find families for these folks to attach to. But the truth is that there are not a lot of foster families raising their hand and saying, I want to take in a 17-year-old. Like I totally admire what Megan has done. I just don't think that it's necessarily realistic to imagine that there's a huge population of folks out there willing to do that. And one of the ways that we can help these kids is by putting them into appropriate settings that may not be family, but mimic family in a lot of ways. They're group homes. Often they're two, house parents who have been paid, full time to deal with maybe 6 or 7 kids who are teenagers, and try to sort of get them used to what it would be like to live in a family again, what it would be like to have dinner around a dinner table, to do chores, to go to school every day, and to see also, like, I think it's important in those homes, you see something like Utah Youth Villages or something like that, where you see an actual, a couple who are the house parents, you get to see a marriage, like you get to see a marriage working up close. So even though it's not a family foster home, what Family First did is it said anything that is a group home or congregate care, we are severely restricting the funding for. And if you look around the country and see the placement crisis that we're having, the hundreds, thousands of kids this past year have slept in offices, homeless shelters, emergency rooms. It's outrageous, and I think it is frankly one of the unintended consequences of Family First.
Thank you, and I appreciate that. No, we're cutting it close to time, but I want to squeeze in as much as we can with the time we have left. Megan, I want to turn to you. We have another question here that you can either answer or just some closing thoughts. Let's keep it to maybe 2 minutes or so we can make sure we end on time. But this question here talks about, do you think that federal transfers to the states on a per child in the system basis does not incentivize states to focus on solutions that reduce the number of children in the system? And it's here on the screen as well. So any closing thoughts or thoughts on this question as well, Megan, before we wrap today?
I'm actually not quite understanding the question here.
Sure. Well, why don't we get some closing thoughts, if we want to get some comments as well with clarification, we can do that. And then Naomi, you can also take a look at this. So Megan, any closing thoughts here on this conversation? Anything that we want to have, takeaways? We've heard a lot of great things about prevention upstream, but anything else that you want our viewers to take back into their communities?
I agree with Naomi. I think getting appropriate settings for children and youth group homes. We've seen really great group homes. And they are really great for kids, and they do need that stability. And I do think mental health is a really huge issue, and there needs to be more resources and support for children and families that are in the system, and making sure, even preventative, that mental health services are available for families, because there is just very, it's underlining and impacting families in a lot of different ways, and children. And just the importance, prevention's hard because it's hard to determine what you're deterring in the community. And I agree. I think there needs to be states and localities need to focus on prevention and services, but also not take away from the services and support in the system. And so you need to be able to find that balance, but both are really important. And just the importance of everybody can do something. If you're watching this webinar, I hope that you do take action. And not everybody can be a foster family. Not everybody can be guardian ad litem. Not everybody can be a policy expert, but you do have a voice, and you can make a difference in your community. And whether it's donating to groups that are supporting, prevention or in the system, donating, diapers, or, getting involved in some of these, larger pieces, or volunteering if you're in the state of Florida with Better Together, or starting a jobs program in your state through Better Together. All these things do, if everybody would do something, I think our world would look a lot different. And we should be doing everything in our power and capacity to keep children safe. As a community, that should be our number one concern, and we should care about that significantly. And it should be our rally cry, and we should be giving these kids a voice, especially a voice to these kids who have nobody to speak for them at all. And I think it says a lot about our society and how we treat children. So I think it's really great to see states. You're starting to see a lot more states talking about foster care and doing some reforms. And it's great that Policy Circle, thank you guys so much for doing a brief on this issue and just shining a light on it. Because it just shouldn't be ignored, and there needs to be more voices, and there needs to be more people contributing and supporting this issue.
Thank you, Megan. Really appreciate your insight there. And Naomi, if you want to wrap up any of the questions that weren't unanswered or just any closing thoughts before we leave here today from this conversation.
Sure. I mean, I just wanted to maybe address the last question that was posted, if I understand it correctly. I mean, I think that the way we are reimbursing states for foster care is a problem, and I think what we need to be paying states for and incentivizing states, because nobody ever wants to take away money from child welfare. You don't want to be that person, but can we provide some kind of carrot and stick, carrot program here more to sort of reward states for, I think, providing more than enough capacity. I think we should, states should have a sense of whether they should have more than enough foster homes. They should have more than enough beds for different kinds of placements. If a child is in a mental health crisis, if you have a teenager, if you have somebody who is aging out and they need, transitional housing services, we should make sure that these kids who are our most vulnerable kids have every option available to them. And we're not just paying when there's, a kid in a bed. When that kid enters the system, you should not be sort of saying to the 2-year-old, oh, well, we only have a foster family who's able to take in teenagers, so we'll throw you there. Or we only have a bed in a mental health placement, even though you don't need mental health services, so we're going to put you there. I mean, so I guess my feeling is that the system really needs to be oriented around the needs of the child and not the needs of the adults around the child, which I think is unfortunately where we've gotten to at this point.
Thank you. Appreciate your touching on that last comment. Well, unfortunately, we do have to wrap because we want to be cognizant of the time. But I want to take a second to thank you, Megan and Naomi, for not only being here today, but the incredibly important work that you are doing. So thank you both for joining this call today. And thank you to our audience as well. We had a really robust conversation in the comments. I know I still see some coming in from your perspectives, your questions, and your analysis of what's happening in your community. So thank you again for joining this program and for sharing your insights as well. Now, before we wrap our conversation today, please take a moment to learn more on how you can take action. Aside from what Megan and Naomi just shared, you can host a conversation using our foster care brief. This can be a policy circle conversation, or you can gather your work colleagues or friends or different stakeholders in the community to discuss and brainstorm and come up with innovative solutions from this understanding and deepening conversation from our foster care brief. You can identify local organizations like Better Together that we've heard from today and some others mentioned in our brief to see how you can support your local community as well, and much more. So we are grateful for you all for tuning in today. We hope you enjoyed today's conversation. And if you found this program compelling, we urge you to consider joining the Policy Circle. We are a growing community of curious, thoughtful women who are stepping up in our communities to have a positive impact. So you can learn more, visit our brief library, and discover what the Policy Circle is putting on in virtual and upcoming programs around the country at our website, www.thepolicycircle.org, to learn more. Thank you all for joining, and we'll see you next time.